Hi, my name is Katie. I'm a physician assistant. I work here at the clinic. What brings you in today?
I was at a health center fair, and they were doing screenings for a lot of different things, and they screened me for hepatitis C, and my test came back positive.
That's big news, huh?
Yeah.
When was that?
That was a few weeks ago.
Okay.
Yeah.
Okay. And where do you think you got hepatitis?
I'm not really sure, but they were saying that I could have that you could get it through needles or tattoos, and I did do needles at one point in my life in my early 20s, and then I got a tattoo when I was in prison.
Okay. And how old are you now?
I'm 30 now.
Okay.
Yeah.
And when did you start using IV drugs?
I did it like one time in my early 20s,
Okay.
and then that was it. I didn't do it again after that.
Okay. Did you ever use cocaine or any other type of drug?
No, I didn't.
Okay. And when was the tattoo?
The tattoo when I was in prison about a year or so ago.
Okay.
Maybe two, and
Did they test you in prison for hepatitis?
They didn't. They offered, but I didn't take it up.
Okay.
Yeah.
Okay. And have you ever had an HIV test?
I'm positive for HIV.
Okay.
Yeah.
How long have you done that?
I've been HIV positive now for the past 10 years.
Okay. And are you in care or out of care?
I do go to a health center down in Center City, Philadelphia.
Okay. When was the last time you were there?
I'm sort of in and out of care. I haven't been there for like a year or so.
Okay, so you're not on any medications right now?
Currently, no. I'm not taking any medicine.
Okay.
Yeah.
And the last time you checked your numbers, do you have any idea what they were?
Well, they said my numbers were good. My viral load was like it's like 50,000 or 20,000, something like. I can't remember, but my CD4s were really high.
Okay.
Yes.
All right. Good. All right. So you want to get all your care here?
Yeah, I would prefer to come to one place. It's just more convenient,
Great.
and I could, just peace of mind.
Yeah, we're really happy to have you. We treat HIV and hepatitis C here.
Okay.
And we also do primary care, so just regular colds, allergies, high blood pressure, things like that.
Okay.
We can take care of everything here.
Oh, great.
So we're really happy to have you. And hepatitis C and HIV, as you know, contain a lot of questions and a lot of processing. So we're not going to cover everything today.
Right.
So we're going to meet over a series of visits to do some tests and to do some talking, and we'll get to know each other a little bit, and hopefully you'll learn a lot more about hepatitis and HIV during your time here.
Good.
Do you drink alcohol at all?
Yes, I do.
Okay. How much do you drink?
I may drink a shot a day.
Okay. And about when did that start? When did you start drinking? You're 30 now.
Maybe about last 5 years or so. Just a shot.
Okay. Was there ever a time in your life when you didn't drink?
My teenage years, I didn't drink then.
Okay.
Yeah.
Well, the first thing we need to do is establish whether you have hepatitis C chronic.
Okay.
There's a small percentage of people, about 20%, that get the hepatitis C virus and then they clear it.
Right.
So they develop the antibody,
Okay.
and that comes up on that test that you had in the community.
Okay.
But they weren't actually looking for the virus. So the first thing we need to do before we start talking a lot about hepatitis is confirm that you have chronic hepatitis C.
Okay.
And that's a simple blood test.
Okay.
Since we're drawing your blood, we're also going to check your liver function, see how it's doing. We're also going to check your HIV status and see how your T cells are
Wonderful. I
holding
wanted
up.
to know that.
Yeah. So we're going to do a lot of blood work today. I'll do a brief physical exam.
Okay.
And then before we meet again, I just want you to write down any questions you might have about hepatitis C, things you might have been hearing about it in the community, or HIV. I know you've had HIV for a while, but sometimes more questions come up.
Okay.
Now, the one concern I do have is that HIV speeds up the hepatitis C.
Wow. Okay.
Hepatitis C usually doesn't give you any symptoms for about 20 to 30 years, depending on the person.
Okay.
And so you're pretty young. You're not going to be sick with the hepatitis yet.
Right.
But when your liver starts to fail, you would get sick.
Oh,
And that's probably what you've heard about.
Yeah.
And have you known anyone that's had hepatitis C and gotten sick?
Yeah. They look real bad.
Yeah. So that's what we want to avoid.
Okay.
And so in order to avoid that, we need to treat the hepatitis and protect your liver, care for your liver before any of that even gets here. Okay, so right now, if you do have the chronic form of hepatitis C, you shouldn't be having any symptoms, but we want to prevent your liver from scarring and then developing symptoms.
Okay.
And the one thing that we can do now, if you do have hepatitis, and if you don't, to make your liver more healthy, is to slow down on the drinking.
Oh, wow. Really?
Yeah.
Okay.
And we can help you with that here. We can have you meet with some of our behavioral health professionals, and they can help you make a plan to try to cut back to protect your liver. Because having HIV is hard on your liver, having hepatitis C is hard in your liver. So that's 2 strikes, and you don't want to give it the 3rd strike. That's the one that you can control.
Okay. All
So
right.
we really want to work on cutting back the alcohol. That can be your one task for today.
Okay.
Okay.
Wow.
So we're gonna do the blood work. We're gonna give you a few things to read, just some brief overall information about hepatitis C. And like I said, we'll meet again in 2 weeks to go over the blood work and talk some more.
Okay. Great. You've been really helpful. Thank you very much.
Thanks for coming in.
All right.
Bye bye.